When it comes to our eyes, we all want to see our best, and many of us want to look our best as well. That's where an oculoplastic specialist can help. And it turns out I have one right here with me today. This is Dr. Lauren O'Neill. Thanks for taking some time to answer some questions today.
Thank you. Happy to be here.
Oculoplastics, kind of a big term.
Yes.
What does it mean?
So oculoplastic specialists, also referred to as oculofacial and orbital surgeons, pretty unique subspecialty of ophthalmology. We really kind of treat a lot of different conditions involving the upper and lower eyelids, the eyebrow, the forehead, the tear duct, which is called the lacrimal system, and the eye socket, which is sometimes referred to as the orbit.
What are some of the conditions that you can help with?
Yeah, so some of the more common things that we see and manage are droopy eyelids, eyelids that are malpositioned or in the wrong position. So some patients suffer from eyelids that are turning in and causing a lot of irritation on their eyes, maybe rolling out and causing a lot of eye dryness. We also treat tear duct problems, so tear duct blockages or tear duct obstructions. We treat a variety of things that happen inside the eye socket, so tumors that are in the eye socket that can be causing vision loss. We also are cosmetic surgeons, so we treat a variety of aesthetic concerns that patients may have, whether that's under eye bags or wrinkles around the eyes. That's kind of all in our wheelhouse.
What kind of training goes into that? Because that's a lot of conditions.
It is,
just listed.
yeah. So, we start out with 4 years of medical school and then a 4-year residency in ophthalmology, followed by a 2-year fellowship in oculofacial and orbital surgery. And that is governed by the American Society of Ophthalmic, Plastic, and Reconstructive Surgeons. And that's really where we get kind of that hands-on, rigorous training that makes us the true eyelid experts.
Some of the conditions you mentioned, some of them sound more like the plastic side of what you said, but some of them also sound like things that impact our vision.
Yeah.
So do you do both? Are you helping the way we look and the way we see?
Of course, yeah. I think, obviously we have a lot of goals when we address patients, but first and foremost, we want to make sure that patients have eyelids that function well. So we blink somewhere around 20,000 times per day. So it's really important that we restore the mechanics of normal eyelid structure. But obviously, a very important goal also is to give patients the aesthetic outcome that they're searching for.
So how does somebody know if this is the kind of specialist that they need to see?
Yeah, so typically we get referrals from patients' optometrists or ophthalmologists, but we also see a lot of patients referred to us from their primary care physicians, dermatologists, so they come from all different places. A lot of times patients have searched for answers from a variety of different providers. They've seen a lot of doctors really before they end up in our office. We are pretty rare subspecialists, so there's only about 500 of us in the country. Wow. Yeah, and only a handful of us here in Nebraska. So it's really nice when patients come to us and they've seen lots of other doctors to finally be kind of the last stop for them and provide them with the answers that they've been looking for.
So when it comes to surgeries, what kind of surgeries do you perform?
Yeah, so some of the more common surgeries that we perform are addressing droopy upper lids, excess skin on the upper lids, which is referred to as a blepharoplasty. We also address tear duct problems, problems with the eyelids that are in the wrong position, tumors in the eye socket. We can address under eye bags. So it's a big spectrum of pathology that we see and treat.
Eye surgery sounds kind of intimidating. What are most of these procedures like as far as preparation for surgery, actual time of surgery, and recovery?
Yeah, sure. So the majority of our surgeries are done as an outpatient, which means the patient comes to the hospital or to the outpatient surgery center, has their surgery performed, and goes home the same day. So not typically an overnight stay in the hospital, which is great. As far as after surgery, there is a huge spectrum in how patients heal. But for the most part, patients can expect to be a little swollen and bruised for about 2 weeks or so. We do expect and ask our patients to avoid strenuous exercising, heavy lifting, anything that really gets their heart rate pumping for approximately 1 week after surgery. And then typically we have patients return to the office for a postoperative exam 7 to 10 days after their procedure is done.
And is their vision affected by these procedures?
Yeah, so any amount of swelling around the eyes can surely impact vision, cause it to be a little bit blurry. But for the most part, our patients are able to go home, watch TV, get around their house, take care of themselves without any trouble. I tell my patients you can expect to have blurry vision for maybe 3 to 5 days. You may not want to drive for those first couple
Bring
of
a
days.
driver with
Yes,
you to surgery.
yes, of course. Yeah, but for the most part, recovery is pretty smooth, typically very painless. So although you may be pretty swollen and black and blue, look like you were in a boxing fight, you don't necessarily feel that way.
You said you get a lot of referrals maybe from primary care providers, but if someone's self-referring, if somebody's watching this video right now and they're like, I have a condition that this might be able to help.
Sure.
Is a consultation the way to start, and what can they expect from a consultation?
Yes, yeah, we would love for patients to call in and schedule a consult with us. I think, we feel very proud of our team here at the Trulson Eye Institute. We have an excellent team, and we really strive to give patients, a great experience from start to finish. So once they've scheduled a consult, they will come to the Trulson Eye Institute. They'll be greeted by one of our lovely medical receptionists.
They are lovely.
They'll get them checked in, and then one of our ophthalmic assistants will take them back to an exam room like this, where they'll check their vision, get a history, go over their medication list, and then typically we meet with them after that. Because this is a teaching hospital, sometimes we're accompanied by a resident or a medical student, which is great. And then during the consultation, we really focus in on what the patient is experiencing, the symptoms that they're having, how that's affecting their daily life. We'll do a focused clinical exam and then kind of delve into the treatment options and what they can expect from those various options.
There's not a lot of people that do what you do. You told me this is a highly specialized field, so what do you like about it?
Oh gosh, everything. So like I said, I really like the diversity of pathology. There's no two patients in any given day are similar or the same. So every patient is so unique. We get to treat patients that are young, newborns, all the way up to 80, 90-year-olds. So it's a really fascinating field. We also get to work with a lot of other subspecialists. So whether that's ear, nose, and throat, oral maxillofacial surgeons, neurosurgeons, it's great to collaborate with other people.
One last question for you.
Yes.
What else should people know about oculoplastics?
So I think the thing that I really want people to know is that we really consider ourselves the eyelid experts. So if you have a condition affecting your eyelids, we would love to see you. We would love to discuss your concerns and the symptoms that you're experiencing. I think our job as surgeons is to present patients with all of the various treatment options and then really allow them to be kind of an active participant in their care and deciding what's best for them. I think here at UNMC and Nebraska Medicine, we really have a culture of innovation and collaboration. And so we have lots of subspecialists in various different fields, and I think Nebraska Medicine really attracts some of the finest surgeons. So it's great that we get to work with other people and really give patients kind of the full experience and the best treatment option.
Always that team experience, and then the patient gets to be part of the team too.
Yes.
All right, Dr. O'Neill, thank you so much for your time today.
I appreciate it.
For any of you watching who are interested in a consultation, just check out the website, nebraskamed.com, or you can call 402-559-2020, 402-559-2020.